Shelley Phelps. And we're also joined here today by the former Conservative Health Secretary, Stephen Dorrell, who now chairs the NHS Confederation and is also heading a 5-year project to improve health and social care in the Birmingham and Solihull areas. I'm going to remind you, Stephen, of a conversation that you and I had when you were Health Secretary, and you said that you envisaged for the NHS what you called a best value health service. Mm-hmm. How does that square with this picture that we have there of deficits, bed blocking and the so-called care gap?
Well, I think one of the things that we tried to do, and you're very kind to remember what happened when I was Health Secretary, it's now quite a long time ago, but in the intervening years during the Labour years and during the coalition years, we've talked about the need to join the health service with social care and with other essential local public services. We've talked about it, but we haven't done it. And that's why last summer, Simon Stevens, the Chief Executive of the Health Service, came actually to the NHS Confederation conference and said, if you want sustainable good value healthcare, you need to invest in social care and other public services so that the health service isn't trying to deal with all of these problems on its own, because it can't. And indeed, it shouldn't. That's not what it's there for.
Investment obviously is a big issue, but around the edges there may be things that can help. I was surprised to be contacted the other day by Hertfordshire County Council when they heard that we were doing this item, and they said that they've actually established a sort of online one-stop shop where it's possible to see, almost like an app, what hospital beds need, beds, care in the community, and you can fit the two together. There's even a system for self-carers and individuals to use this. That might be something that might be useful more generally, maybe Birmingham and Solihull as well.
Yes, joining these, the essential truth is that if you want to deliver high value, high quality, good value healthcare, you have to see the health service as part of a range of public services. Quote an example. When they addressed some of these issues in the state of New York, another contribution to the NHS Confederation conference last year, we asked what was the most effective health intervention in the state of New York. The answer was improved housing for low-income groups, so that people could look after themselves and live independently and not rely on the health service to deliver what is essentially social care.
It seems that what Stephen is saying, that under the watch, if you like, of both your administrations, we've become over-dependent on the most expensive form of health care of the lot, which is hospitals. When Labour were in, you doubled the investment in the health service, and yet, as we now know, many hospitals were heading towards clinical and financial unsustainability by the end of the period.
But what you can't do is take this in isolation. So we put more money into the hospitals, which was right. The Conservative government has then taken 4.6 billion out of the social funding, which is an integral part of that. And on top of that, in those years, you had a change of demography, which means those people who need it, the numbers are increasing. So what I think you need to do is, yes, look at the structural arrangements, but you do require some cash injections on that, which goes beyond just raising your council tax. And we've just done surveys on Change Britain, which so says, well, whichever side on the Brexit argument we're on, Leavers and Remainers, over about 70% of them are saying that the Chancellor should actually take about 100 million out of what we're going to save on our EU membership and put that into the NHS.
Oh, but that's still less than you would have promised on that bus of yours. But well, with the budget coming up, maybe the Chancellor's got a bit more wriggle room. We hear about maybe an extra 12 billion or so. So is there some investment due?
Well, I have no idea what the Chancellor will do in the budget, but you've heard already from Sajid Javid that there will be more money going into social care. And of course, we're putting a lot more money into the health service. But I think Gisela's right. This is much more than a financial problem. This is a demographic problem, and it's a cultural problem. And I think we have to think not just about the amounts of money we put into social care, but what we need to do to improve, as Stephen says, the join between health and social care. I went through this with my own father. Many people will recognise this. There are problems with duplication of assessments. There are problems with getting people home with the necessary physical improvements to their own home, even if it's as limited as a grab rail in the bathroom. And as the couple you saw in the film there demonstrate, it's also about making sure that carers back home are properly looked after, and that's why we put more money in to carers' assessments and to making sure carers have breaks when they need them. All of that has to happen and function effectively if you want good social care.
Briefly, Stephen, how do you see this problem in terms of what is widely seen as an imbalance, not enough funding going into social care in the local authorities, and the whole question of the deficits in the NHS? What would you see as a solution?
I think the solution is a combination, as Jeremy said, of more money to the health and care sector as a whole. And frankly, I'd say to both my former colleagues in Parliament, not playing party politics. One of the interesting things about the health and care sector is that if you look through the party politics, the trends are, you can't see the change of government in the trends within health and social care, except when governments put more money into it. Now, at the moment, the budgets are unrealistically tight looking forward. What we need to do is to create more resource, but address some of the policy questions that governments of both political complexions have avoided for far too long.
Very quick one-line response, if I can, to that from each.
You cannot say, yes, I keep it right to the NHS, but then take, as I say, 4.6 billion